Welcome to America's Heroes Group.
And welcome to America's Heroes Group Roundtable with partner Veteran Healthcare Policy Institute. Today is Saturday, October 16th, 2021. October is National Breast Cancer and Domestic Violence Awareness Month. Thanks to the host, Cliff Kelley. My name is Sean Claiborne. I'm the co-host today, American Heroes Group. Also, Vietnam veteran Cliff Kelley is our great host who actually gave us our announcement earlier in this broadcast. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honors Productions. So we have a great panel today. We're going to talk about some things that are really, really important, especially when it comes down to the VA system and also what's important about leadership in the VA system. If you're listening to us on our live Facebook Live, thanks for tuning in. Please join America's Group now on our global live streaming on Facebook Radio Talk Show. Like and share so others will become connected to information and resources. You can also listen to America's Heroes Group on the iHeartRadio app. Just search America's Heroes Group and watch us on digital TV streaming on Roku, Amazon Fire TV, Apple TV, and through our partner Zondra's TV networks. That's Zondra, Zondra, on the Roku app. Now, we have a great guest. Her name is Suzanne Gordon. Now, Susan is the Veterans Healthcare Policy Institute Senior Policy Analyst. And that Veterans Healthcare Policy Institute is actually a nonpartisan think tank focused on veterans issues. You might have heard Suzanne on CBS Radio's NPR's Marketplace. You might have seen her some of her articles in Harper's, The Atlantic, New York Times, the Boston Globe, and the LA Times. And she has done lots of lectures across the country on this topic. Suzanne, are you with us today?
I am. Thank you so much for having me.
My pleasure. So you've authored about 21 books. Is that correct? Is that count correct right now?
That is correct. Authored, edited, or co-authored.
Okay. And then some of the things you're talking about have to do with veterans health care and also about better practices in the healthcare field. Is that right?
Yes. I wrote a book called Wounds of War, How the VA Delivers Health, Healing, and Hope to the nation's veterans, and I helped found with my colleagues the Veterans Healthcare Policy Institute.
Okay. So tell us now, let me explain something here. There's one thing you wanted to talk about is the vital role that's unfilled at the VA, the Undersecretary for Health. And so people understand the Undersecretary for Health is the highest official directly responsible for veterans' health at the VA. This position is frequently held by a licensed physician. However, from what I understand, since 2017, there hasn't really been a full-time person in that role. Is that right?
Yeah, there's the Trump administration they didn't nominate for confirmation at the Senate a permanent Undersecretary for Health. They had an acting Undersecretary who was a physician named Dr. Richard Stone, and then since he was elected, Biden seems to have continued that practice, and now there's a gentleman called Stephen Lieberman who is acting undersecretary. But having an acting rather than a permanent position is really not a good idea for a number of reasons. I mean, the dynamic of having an acting person rather than someone who's a leader who's been vetted and chosen and nominated in his own right or her own right means that they tend to be quite dependent on the leadership of the secretary rather than really leading. And they tend to be more sort of managerial role, manager rather than a leader. And it's just a bad dynamic. And then in the field, when you don't have an a permanent leader, folks in the field go, well, this person is replaceable. Why should I listen to them, So it's generally not a good idea. And it's not clear to us at VHPI or to other people that we've talked to whether the Biden administration has really a kind of a robust vision for the VHA or for the VA in general, but I think for the Veterans Health Administration, which is the largest sub-agency in the VA, the Department of Veterans Affairs, I think the attitude tends to be just don't give us embarrassing headlines, not really this kind of proactive we have this great healthcare system. What are we going to do to strengthen it and expand it and promote it? And that's, I think, if you need somebody who's very highly qualified at the top, and who's permanent, and appointed and so forth.
So why has it been so difficult to fill this role? And we can go back to 2017. I think the last actual undersecretary we had was David Shulkin, and he got promoted, and then he was ousted not long after that, after his promotion.
Yeah, so Shulkin came in 2014 after the Phoenix wait time problems, and Shulkin was, had no experience of a public health care system nor no VA experience. And I have a lot of concerns about his leadership, both as Undersecretary for Health and as Secretary of the VA, which he was briefly under Trump, because I think he really was a sort of a stealth privatizer. He talked a good game when you talk to him and in some of the things he wrote, but when you look at what he did, he set up a website on the VA, basically advertising all the people he'd fired and disciplined. He really promoted a much smaller VA. He wanted to outsource things like audiology for hearing, which is a major specialty of the VA. He wanted to send veterans to the private sector. He once famously said, there's a lens crafter on every corner. Why do we have to do optometry? And so I think his leadership, although he was permanent and appointed, was not necessarily full and robust. But then under Trump, who really favored completely privatizing the VA, he had no interest in a strong leader who would have a vision of his own and promote it to strengthen the VA, because he wanted to privatize it. I'm not convinced that the Biden administration's leadership of the VA grasps the importance of the system, how it could be and has been a model for American healthcare, and why it needs strong leadership at the top. I'm not sure they want that.
And it sounds like by not having that role filled, then that you have less of a pushback if your goal is to the end result be to privatize the VA system, the healthcare system, at least anyway. Then it might be easier to do that.
I just don't. I just think that the Biden administration, having the attitude of just don't give us any problems, is not really a very productive one. The Obama administration really kind of had that attitude as well, and it didn't get them very far. It created problems, and I'm very concerned that if they don't have strong leadership at the helm, someone who has a bold vision, and let me just say that this is the VA Undersecretary for Health is certainly not a household word. It's, and to many Americans, the Veterans Health Administration is, they don't really, they see the signs for VA hospital, but they have no idea what's done there. Most Americans think every veteran can go to a VA hospital or medical center, and that's not true.
Right, exactly.
They don't even know that there's all kinds of convoluted eligibility requirements that stand in the way of many veterans getting care that they were promised and that Americans actually think they're getting. And they certainly have no idea who the Undersecretary for Health is, and they don't probably even know there is such a thing. So this is kind of an obscure position, but it's extremely important, and it's very important for the Biden administration to get this position right, because, this is the largest healthcare system in the country. It's the most complex. It now straddles private sector care because of the privatizers in Congress who've outsourced so much care to the private sector. The person who's the undersecretary needs to know about public health, population health. They need to know about the specific problems of veterans, which are very different than, my problems, as a 75-year-old woman. I don't have 15 presenting problems. They have to understand politics. They have to, sit and be grilled by a very hostile, these very hostile committees in Congress. And the position, probably it's in the low, six figures. I mean, this is a person who's fundamentally the CEO of the largest healthcare system in the country. Mm-hmm. The equivalent position in the private sector, they would earn, $15 million a year.
Yeah, about to say. But the thing of it is that this position has so much controversy and history behind it. I mean, but previous to Shulkin, you had two guys, the Robert Pretzel, the VA, and also the VA Secretary Eric Shinseki. I remember back then they quit because of the tons of controversy with what you mentioned before, the Phoenix incident where 40 veterans were dying, died waiting for appointments.
Shinseki was forced to resign, and so was Pretzel, so it's the average tenure of a VA secretary is about 18 months. The most famous and I think best VA secretary, VHA secretary, Undersecretary for Health, was Ken Kaiser under Bill Clinton, and he served 5 years, and that was the longest tenure in VA history. I mean, this is an inherently, unstable position, even if you have a bold vision and you have an administration supporting the VA, because let's say right now they found the perfect candidate who would be willing to take a pay cut and has all the qualifications and would like to sign up for an essentially thankless job. I mean, it's inherently short term because they can't say to this candidate, "Oh, don't worry, Joe or Jane or whatever your name is, you'll be there for 10 years. I mean, their boss, i.e. the president, has no guarantee that they'll be reelected. Mm-hmm. It's a hard position to fill. And, if you don't have, if the administration doesn't really make it clear that they want somebody with a bold vision and they'll support that somebody, then, the person, any candidate worth their weight will not be eager to join because they don't want to work for an administration that basically is reactive rather than proactive and will nix their ideas for political expediency.
Mm-hmm. Now, what about all the issues the VA's had in the last, forever? It seems like there was an issue even with falsified records. I don't know if you can speak to that.
That's not forever. That was a very short-term problem that was brought on by poor administrative decisions at the top. I mean, this was a scandal that was created, not inherent, because they were basically offered bonuses, administrators, to meet unrealistic wait time standards for getting appointments.
Wow!
And this was a bad decision. The VA. It has way better wait times than the private sector.
Okay.
I mean, a friend of mine just tried to get a urology appointment, an older gentleman in the private sector, and was told he'd have to wait for 5 months because urologists, are not interested in a patient who they're just managing, with medications rather than surgery. They save their slots for surgical patients because they can make more money. Mm-hmm. My friend would have gotten an appointment in 2 weeks in the VA. He had to wait 4 months in the private sector. The private sector, a lot of veterans, and it's really tragic in my view, they really think that, private sector healthcare is not only a greener pasture, but a kind of perfect pasture. And, they have the luxury of having, another system that they can go into if they don't like the one they're in. And I don't have that luxury. I would love to be able to go to the VA to get the kind of continuity and integrated care they offer. I know exactly what doctors I would pick. If I could go to the VA, I can't go to the VA under any circumstances.
So how would you grade the VA system then, comparing it? So I'm going to ask you this question in a couple different ways because I'm trying to get a clearer picture especially for people that are familiar with the VA system. So what grade would you give the VA? Now, provided that there's different sectors of the country, and every VA system, depending on where you are in the country, is a little bit different. But
well, I think you just have to look at. I mean, that's a very good question, and you have to look at the studies. I mean, they did a national study recently of veterans who are dual eligible. They have Medicare and VA, and they could go to the private sector under Medicare, or the VA under the VA if they're eligible, and these Stanford economists analyzed 400 different ambulance calls, and these veterans were taken kind of randomly to either a VA or a private sector hospital, and the veterans who went to the private sector hospital were twice as likely to die in 28 days than they were at the VA, and they paid 21% more, either out-of-pocket payments, Medicare paid more. So, there's all kinds of studies that show that the VA is better than the private sector on a whole bunch of different measures. I mean, African Americans, there's a couple of cardiac conditions that they do better than Caucasians in the VA, because in the VA they have access to health care, and it's integrated health care, coordinated health care. So are there problems? Yes, of course. Are there clinicians, doctors, nurses, clerks who wake up on the wrong side of the bed or aren't as good as others? Of course. But I think as a whole the system is very good in the models of care that it offers. I mean, I wish I could go to the VA. I really do. I wish I had choice. I don't have choice. I'm stuck with a fee-for-service, profit-driven private healthcare system where, I mean, it's kind of sometimes a joke if it weren't so tragic. Can you get good care in the private sector system? Of course. Are there some places that are good or better than others? Of course. But I think your model of care at the VA in general is a lot better. And if you're a veteran and you have a problem at the VA, how do you fix it? You don't fix it by leaving. You fix it by going to your congressman and making a fuss. And you can do that at the VA. If I don't get good care in the private sector, and I call my congressman because, my husband or friend can't get a urology appointment for 4 months, I mean, they'd hang up on me. They'd laugh.
And then also, too, in the private sector, you have the litigious factor where people are really eager and quick to sue when things don't go right.
Yeah, and by the way, you can be as litigious as you want in the private sector, but only 2.6% of actual malpractice cases, that is, real malpractice cases, ever get to court. And we never learn from them because you have to sign a non-disclosure agreement if there's a settlement. So in the VA, every problem that emerges, there's some kind of Office of the Inspector General report, Government Accountability Office report. We learn about those problems and how to fix them. You can't learn about problems in the private sector, because we don't know about them.
And how do we get more consistency across it? Because here in Chicago, we're lucky. We have Jesse Brown, which is a great facility. We have the one in May, which is a great facility. But the problem is you have parts of the country, like in D.C., for example, where even the nurses spoke up years ago about the horrible care that was happening at the D.C., the Washington, D.C. VA. How do we get more consistency across the board?
I think there has to be leadership at the top. I mean, right now I'm very concerned about the fact that, they've had some toxic leadership in the regional level in San Francisco and also in Memphis. They've really had bad leadership at the Memphis VA, and who's watching that? That's why you need an USH, why you need an Undersecretary for Health who's very focused, very qualified, and very committed, to making sure that things run smoothly and effectively. I think there are probably less. I think that, you have to make the distinction between an individual clinician or doctor or nurse or clerk or whatever who's not good in a system. And if you have over 300 and something employees, you're going to have some people who aren't great, right? I mean, kind of ipso facto. That's true in the private sector, too. But I think that, overall, the studies show us that that the VA delivers better care on a whole lot of different measures. And I think the way you solve the problems in the system is through, a leader at the very top, the secretary, having a bold vision, not just reacting, but basically saying, this is a great healthcare system. You are great, employees for the most part, being supportive, and then making sure that, regional management, local management has enough funding, and so forth. I mean, Secretary McDonough, I'm sure, is a very dedicated gentleman, but, he was on Jon Stewart talking about the burn pits, and Stewart asked him, don't we need money to take care of, the burn pit victims, the people who were affected by burn pits in post 9/11 conflicts. And he said, no. Well, that's ridiculous. There are 3.5 million veterans who are potentially patients at the VA. Now, some of them may already be going there, but you need a lot more staff, a lot more exam rooms, a lot more people, and a lot more money to take care of them. But of course, part of the line that the administration is taking is we don't need more money because Congress doesn't want to give the money,
Well, thanks a lot, Ms. Gordon. Thanks for your time. We're running out of time. We're about to get cut off for a commercial break. But thank you very much for your time, and thank you for giving us this information. We got to have you back on the air to talk more about this, too.
For having me.
I appreciate it.